Glad to have you back for Module 2, Working Environment, in your CNA course. We will be focused on a variety of topics that will cover much of the working environment in a health facility. Infection prevention. Did you know that you have an important role in infection prevention? We are going to talk about how you can prevent infections from spreading from one person to another. The objectives. Number 1, explain the importance of infection control. 2, identify groups of people who are most vulnerable to risk of infection. Number 3, discuss the importance of using standard precautions to prevent transmission of pathogens. Sanitation and infection prevention. Have you ever heard of the expression, cleanliness is next to godliness? The term may apply to all of us working in healthcare. By being clean and free of potential disease-causing organisms, also known as pathogens, healthcare staff will not unintentionally pass on these microorganisms to the people they serve. So this is why everyone working in healthcare must be conscious of sanitation and infection prevention. Infection prevention is the set of methods used to control and prevent the spread of disease. Besides sanitizing surfaces and avoiding touching our uniforms to objects, it is extremely important to always wash our hands. One great opportunity to wash our hands is after being in a contaminated or dirty utility room. Those rooms are home to garbage, soiled linen, and a hopper, which is like a large toilet that we may use to rinse out linen or clothing that has bodily fluids and materials on it. Infection has 6 different components that allows it to successfully spread from one host to the other, the chain of infection. If we are able to break one of these links, the infection will not be successful in causing a sickness. Infection starts as a causative agent, such as bacteria or a virus. That agent needs to be able to live in a reservoir, such as the human body, to allow it to multiply and grow. At some point, the infection needs an exit out of the host and needs some sort of transmission to another host or reservoir. This transmission could be by droplet, air, or contact. The agent then needs to find an entry point into a different host. For the infection to be successful, the host would need to be susceptible and not be able to kill off the infection, at least right away. We all can be susceptible to infection. However, these individuals may be at a higher risk for infection. Have you ever gotten sick during a time when you were stressed out? How about when you had poor eating habits? Open cuts are a direct entry/exit point for infection. If you have open cuts or sores, it is advisable to cover up those areas to prevent infection. The elderly are at high risk because perhaps of their weak immune system, having multiple health issues at the same time, and their skin is thin. They are susceptible to skin tears, also known as open areas. Standard precautions. This is defined as a method of infection prevention in which all blood, body fluids, non-intact skin, and mucous membranes are treated as if they were infected with the disease. Mucous membranes are the lining of the mouth, nose, eyes, rectum, and genitals. When working with blood, body fluids, secretions, excretions, open skin, human tissue, or membranes, gloves are required to be worn. If you become exposed to these items, you will need to wash that surface immediately and report to your charge nurse. So an example like blood, you could contract a blood-borne illness if you didn't have gloves. Any material that is potentially infectious will need to be placed in a biohazard bag or sharps container. Sharps container, which is on the right, is suited for items that potentially puncture a person's skin, like a needle. What items may you need to place in a biohazard bag if you are working as a CNA? Bag would be some other items, but they're not going to puncture your skin. Preventing infection. We have discussed the importance of covering cuts, breaks in the skin already. Most of us know about the cough etiquette technique of covering your cough or sneeze by using the inside of your elbow. Have you ever thought about washing that elbow? After you've coughed in it, that is contaminated. Never use another resident's personal items on another resident. When using items such as the stand-up lifts or Hoyer lifts that are in nursing facilities, we always disinfect the equipment before using it on someone else. Toothbrushes harbor many microorganisms that may cause potential harm to its owner. Scheduled replacements for toothbrushes are on a regular basis. Be conscious about placing potential contaminated items on surfaces that residents use to eat off of or put in their mouth. Our friends from the DIA or state also do not want to have soiled clothes, linen, or garbage on the floor. These items that are garbage need to be placed in a bag. If they're dirty, in a bag, so it can't contaminate anything else. Cleaning from the cleanest area to the dirtiest area helps prevent cross-contamination. We'll go over that a lot. Think about it. Would you use a washcloth to wash your face if it was used first to wash your bottom? Finally, wash or sanitize your hands before and after gloving to prevent the spread of infection. Here are a few signs and symptoms of infection. Please report any of these symptoms to your nurse right away. Fever, increased pulse and respiratory rates, pain or tenderness, fatigue and loss of energy, loss of appetite, nausea, vomiting, diarrhea, rash, sores on the mucous membranes. We can inspect those during oral care and feeding. Redness and swelling of a body part, discharge or drainage from the infected area. Hand sanitizer versus hand washing. Hand washing with soap and water is always expected if your hands have visible debris on them. Washing hands with soap and water may also be advisable if you have been working with potential infected items. Hand sanitizer may help kill off the bacteria, but ultimately the debris is still on your hands. Sanitizer works well when first entering a resident's room or when soap and water is not available. A dime-sized amount of hand sanitizer is all that is needed, along with 20 seconds of constant friction from your hands and 2 inches above the wrist. When to wash. When arriving at work, wash your hands. Whenever they are visibly soiled, like I just stated. Before, between, and after all contact with residents, you need to wash. Before putting on gloves and after removing gloves. Before and after touching meal trays and or handling food. Before and after feeding residents. And before leaving a dirty supply room. We always do hand hygiene. Other times, before and after you eat, after contact with blood or any body fluids, mucous membranes, non-intact or open skin, or wound dressings, which are covering non-intact skin. After handling contaminated items, after contact with any object, including medical equipment in the resident's room, and after using the toilet. The list just keeps growing. Are you currently washing your hands after toileting? That will be necessary for your employment. Here are a few more examples. Do you currently wash your hands as often as this course is suggesting, or will you need to work on improving that? After coughing and sneezing, blowing your nose, wash your hands. After smoking, if you're a smoker. After handling your hair or touching areas on your body, such as your nose, mouth, eyes, and face. Before leaving work and after you get home from work. Before touching anything or anyone, wash your hands. As the slide suggests, washing our hands is the single most important thing we can do to prevent or break the chain of infection. Use plenty of warm water and soap and friction for at least 20 seconds. When you go to lab, we will watch you demonstrate proper hand washing. Wearing gloves is one of several personal protective equipment, PPE, that is a part of the standard precautions that healthcare workers use. Other pieces of equipment include gowns, masks, goggles, and face shields. Gloves. Gloves are worn whenever there is a potential of working with blood, body fluids, open wounds, or mucous membranes. Skills that require gloves will be worn when we do oral care, shaving a resident, perineal care, and washing a person's private areas. You can glove when in doubt, but be careful that you don't cross-contaminate other surfaces with your dirty gloves. Once you've touched an item with your glove, if it wasn't a clean piece of equipment, you have now contaminated your glove. Once you touch your uniform, you have contaminated that glove. Never leave the room with gloves on, even if the gloves are clean. You may potentially pick up other contaminants from outside the room and reintroduce them to your resident. If you're leaving a resident's room, you must de-glove and wash your hands. Gloves need to be removed once they're dirty, like I've stated. You also need to remove the gloves before you touch anything clean. That includes taking off your gloves before pulling up a resident's pants after toileting. You'll get used to removing and putting on new gloves. Please do not wear the same pair of gloves when working with different residents. You will need to take the old pair of gloves off, clean your hands, and then re-glove prior to working with a different person. Handling linen. Linen includes bedding, towels, washcloths. Those are probably the most popular. Handling any type of linen may be a potential cross-contamination to you and your clothing. It is important to wear gloves when touching linen or clothes and to keep those items away from your uniform. Please check pockets in pants and shirts for items such as hearing aids if you are cleaning up a resident's laundry. If removing bed linen, check under the sheets by lifting them up and then look for foreign objects such as dentures or glasses. Make sure those items don't go to the laundry. We've seen dentures go down to the laundry. That's not a good thing. Fold or roll the linen so that the most dirty area is always inside and contained. Cleaning up spills is everyone's responsibility, not just the housekeeper. These spills could potentially cause someone to fall and hurt themselves or cause a mode of infection to spread. Follow your facility policy on spills. The CDC, Centers for Disease Control and Prevention, has recognized that standard precautions may not be enough to prevent infection. They have added 3 more categories of transmission-based precaution that can be used in addition to standard precautions. The 3 categories are airborne precautions, droplet precautions, and contact precautions. Airborne precautions is usually conducted at a healthcare facility such as a hospital because they need specialized rooms that never allow air to leave the room except for by a special filtered vent. All staff in these rooms wear special HEPA masks, and that helps filter the air. And the person served would be in an isolated private room, so they are the only ones able to breathe in that air. An example of a disease that is airborne would be active tuberculosis, or TB. Droplet precautions will help prevent healthy individuals from acquiring an illness from droplets expelled from an affected person. Besides standard precautions, we additionally add a mask to be worn to prevent all affected droplets from being released into the room. Cough etiquette is advisable, along with limiting visitors to these patients. A privacy curtain should be pulled if a room is being shared between 2 people. Normally, droplets do not travel more than 3 feet, but they can go as far as 7 to 9 feet. Talking, coughing, singing, and laughing could all help transmit those droplets. An example of an illness needing droplet precautions is influenza. A lot of respiratory illnesses are spread by droplets. Contact precautions. That is used when an infected person can spread that infection by direct contact, touch with another person. Personal protective equipment are used to protect the clothing of the staff from cross-contamination, as well as gloves and gowns. We would dispose that after each use. And an example of contact illness would be conjunctivitis, which is pink eye. It's highly contagious through touch. Occupational Safety and Health Administration, OSHA. That was created to assure that safety and healthful working conditions were occurring in the workplace. OSHA has established rules and regulations for healthcare employers and workers to abide by. Two types of infectious waste that have been identified by OSHA are blood and body fluids. Risk or infection to healthcare workers. Healthcare workers are often working with blood and body fluids. Possible ways that healthcare workers can be exposed and potentially infected include needle sticks or sharps, working with mucous membranes, cuts, and having non-intact skin. Attention! If you become exposed to blood or body fluids, you need to report that to your charge nurse right away. You may need to seek treatment for your exposure, and that is a safety measure. You will also want to report suspected infections of your residents to your charge nurse as well. By reporting early, you may help prevent complications to everyone. Bloodborne illness. Two major groups of bloodborne illness disease are HIV and hepatitis. Human immunodeficiency virus is the virus that causes AIDS, you may have heard of. Hepatitis is an inflammation of the liver caused by a certain virus and other factors such as alcohol abuse, medication, and trauma. Liver function can be permanently damaged in hepatitis. The risk of getting hepatitis is greater than the risk of acquiring HIV. Drug-resistant organisms are microorganisms, mostly bacteria, that are resistant to one or more antibiotic treatments. The main reason for this includes the overprescribing of antibiotics and people not finishing their whole course of treatment, instead saving them for later. Healthcare facilities are now asked to try an alternative first to fight off infection, such as increasing fluid intake for a brief time, if there's a suspected urinary tract infection, so we don't become resistant to antibiotics. Two main types of drug-resistant organisms are MRSA, methicillin-resistant Staphylococcus aureus, and VRE, vancomycin-resistant Enterococcus. These are two bacteria that don't respond to two types of antibiotics. C. diff, or Clostridium difficile, is a spore-forming bacteria that can be part of the normal intestinal tract. Sometimes C. diff will flourish if other normal bacteria in the intestinal tract is altered, such as when a person is on an antibiotic and the medication destroys that normal bacteria in the gut. C. diff can take over, and results can be very frequent foul-smelling watery stools. It's highly contagious if spread from person to person. Soap and water must be used for hand hygiene, as hand sanitizer is ineffective in killing spore-forming bacteria. Report symptoms right away, as isolation of the resident will need to occur if tested positive for C. diff. This concludes our beginning of Module 2.